Hello, my name's Elizabeth and I'm the Training and Development Worker for a project called Answer Cancer, the Greater Manchester Cancer Screening and Engagement Programme, and this is a short presentation on possible cancer signs and symptoms to be aware of whilst coronavirus restrictions are in place. Referrals into cancer services are down by as much as 75% in some areas. That means almost 3/4 of people with a possible cancer symptom are failing to seek help from the NHS during the coronavirus pandemic. A referral into a cancer service happens after a person has had an appointment with their GP to discuss something that is causing them distress or that they have concerns about. A GP would, in the first instance, examine the person and may feel at that point that the illness the patient has presented with would benefit from further investigation. They would refer on to a specialist who would make an appointment with that person, usually within 2 weeks, to see them and examine them further by possibly running a series of tests or scans to determine the cause of the problem. Now, the reason that referrals are down by a whopping 75% is both simple and quite alarming. People just aren't visiting their GPs with health concerns like they used to before the coronavirus lockdown. Lots of people don't want to bother their doctors with their symptoms, thinking that the health service has enough to do, or that the doctors aren't seeing anyone, or that they'll go to the doctors once all this is over. Doctors and other health professionals and services are very much up and running and open for business. There may be a few changes into how we access them, for instance. Some are operating a one-way in and a one-way out system, or being asked to wear a face mask and maintaining social distancing measures at all times, but they're still very much up and running and really want to see and help people to get the best outcomes they can during this time. A leading chief medical officer has urged anyone with new or persistent symptoms to seek advice in the way they would have done before the coronavirus outbreak. So we'll cover a few signs and symptoms that people should be aware of so that they can make the appointment to visit their GP if they need to. Just so that we have a rough idea of what signs and symptoms we should be looking out for, I thought I'd take you back in time to a great campaign that took place in 2013. It was one of the first Be Clear on Cancer campaigns that were run by Public Health England. It's the Know4Sure campaign. It was a very successful campaign because it concentrated people's attention on 4 key signs. Key sign number 1, unexplained blood. This is blood that doesn't come from an obvious injury. Say, for instance, if we find blood in our poo or blood in our wee. If we find blood in our poo, it's more than likely this has happened through straining, or if we're a little bit constipated and have caused a small tear, or if we have piles or hemorrhoids. We should keep an eye on this, and if there's no improvement after 3 weeks, then book an appointment to see your GP. The same goes if we notice a change in our bowel habits lasting 3 weeks or longer. If this happens, book an appointment to see your doctor. If we see blood in our wee, this is something we should act on it straight away because it's likely we may have a problem with our kidneys, so we should book to see our doctor immediately. Key sign number 2, an unexplained lump. We all know our own bodies and should get used to checking ourselves regularly. We know what feels normal to us and what doesn't, so we should be on the lookout for anything that doesn't feel or look normal to us. This can include changes in skin such as rashes, dimpling, changes in moles, but especially look out for any unexplained lumps and bumps, as these will need further investigation by your GP. Key sign number 3, unexplained weight loss. Now, I think most of us would agree that it'd be great to lose a few pounds here and there. However, this is a little bit different. If you're losing weight without a reasonable explanation, that is, you haven't changed the food you eat, you're not exercising more than you used to, and you're not on a weight loss diet, then unexplained weight loss is something you should consult your doctor about. It doesn't necessarily mean that you have cancer. There's lots of different reasons that we can lose weight unexpectedly. Rather, it means that there's something going on with you that needs a little further investigation. So if you find that you are experiencing unexplained weight loss, book an appointment to see your GP. Key sign number 4, unexplained pain. This is any type of pain that doesn't go away, something we might think of as persistent pain. Most of us can wake up in the morning with a few new aches and pains here and there. This is a little bit different. It's persistent and doesn't go away as the day wears on. Again, this doesn't necessarily mean that you have cancer. It's just your body's way of letting you know that something isn't quite right. and needs a bit more help and attention to get well. Therefore, we recommend that you speak to your GP about it. Now we know the 4 key signs to look out for, and we also know that having any of these signs and symptoms doesn't automatically mean that it's something serious or that you have cancer. It just means that you need medical attention to help get you right again. But what if we can't remember the know for sure and the 4 key messages? Well, there's one simple message that, if we remember nothing else, we try and remember this. So, we all know our own bodies, so our key message is this. If it's unusual for you, or if you have any signs and symptoms that you're not sure about, or any changes to your health that you're concerned about, it's important that you contact your GP. Don't think you're wasting anybody's time and that your GPs don't want to see patients whilst coronavirus is going on. They're very much still open for business and want to hear from you. Let your GP decide the best course of action for you and your symptoms. After all, they're the professionals. And we all know that early detection saves lives. We know that the earlier a cancer is detected and treated, the better the health outcomes are for those people who are affected. Which brings me on to my next slide. Contacting your GP. Like I've mentioned a couple of times now, doctors' surgeries are very much open for business, although we may have to visit, see or contact them in slightly different ways than we did before. There are a few changes to how we may have previously booked our appointments. For instance, if we used to pop into the surgery and book directly with the receptionist, well now this method has changed. Surgeons are asking for people to go online and book appointments directly through their website if possible. For anyone who may find this difficult, you can still ring up and make an appointment using your telephone. The receptionist will take your details and ask a doctor to ring you back. Which brings me on to how our consultation with our doctor may go. Now, in these current circumstances, we may have a telephone consultation or we may have a video chat using something like Skype or Zoom if possible. We understand that this won't be possible for everybody, and so where the doctor feels the best option would be to consult with you face to face, you may be invited to attend the surgery in person. Again, your doctor will decide what's best for you. I've put a link in the end slide to a YouTube video that explains this in greater depth for anyone needing further information or clarity. The bottom line is, if you feel you need to see a doctor, you probably do. Your GP still wants to see you, to know all about your illnesses and to alleviate any concerns where they can. So go ahead and contact your surgery and book your appointment if you feel you need to. That brings me to the end of the presentation. It's important to remember we will get back to normal and that the NHS and doctor surgeries are still up and running and want to take the best care of you that they can. If you'd like to know more about the work we do, or better still, sign up to be an anti-cancer champion and spread cancer awareness messages within your local community, please feel free to contact us using any of these links. For more information on the Be Clear on Cancer and Know for Sure campaigns, visiting a GP during coronavirus, and for people living with cancer or in treatment during coronavirus, please copy the links on screen into your browser. There is also a link to Macmillan for support and guidance for people affected by cancer during these testing times. Thank you for watching. Bye!